Good morning. As you can see, my audience is at work offshore, but they are listening. I have my computer set up so that they can listen. Today, I'm going to talk about nursing shortage. I believe that the nursing shortage is caused by low pay. Nurses take on a lot of responsibilities of taking care of others and are often forgot about. Low pay is the deciding factor when accepting a job. It often comes to patients being neglected because of the overload of the caseload, and nurses are getting the bare minimum in pay. Nurses should not have to work overtime or two jobs or more to be able to provide for their family and make ends meet. This is where the burnout comes in. Nurses can work for a facility, and the nursing managers will pay a staffing agency 2 times the rate to come in and work, do the bare minimum, when they can just use that money to increase the salary of the nurses already working in the facility. Do you know why there's such a nursing shortage in nursing staffing? There's a great shortage around the United States. Research reports a significant nursing shortage due to factors like an aging population, pandemic-related burnout, and inadequate nursing school capacity. A 2022 Health Resources and Services Administration report projected a shortage of 78,610 full-time RNs in 2025 and 63,720 in 2030. Patients will suffer greatly from this, and nurses will end up changing careers due to the heavier workload with less pay. When choosing nursing as my career, I was influenced by 2 aunts and my mother. They worked in nursing all of their life since I was a baby. I enjoyed hearing the stories of them coming home talking about how they took care of their patients and the family-like environment that they worked in. So I knew I wanted to be a nurse. Think about it. A great nursing shortage could cause a significant decrease in people's well-being and health. According to statistics reported on a 2023-2024 enrollment in graduations and baccalaureate graduated programs in nursing in the U.S., nursing schools turned away 65,766 qualified applications from baccalaureate and graduate programs in 2023 due to insufficient number of faculty, clinical sites, classroom space, and clinical preceptors, as well as budget constraints, per the American Association of Colleges of Nursing. A nursing shortage, for example, will cause a threat to patient care. Nurses are feeling burnout. Nurses are not wanting to work in certain roles due to burnout of the nursing shortage. Nurses are unable to spend time with their families and friends due to the shortage and taking on more duties. Also, there's a greater chance that the nurse will feel depression due to not feeling fulfilled. For example, nursing schools limit the capacity of students that schools can admit and limit the impact on health research and education. This causes a growing faculty shortage related to low salaries, decreasing proportion of faculty in completing research. With nursing shortage being so great in numbers, facilities are paying less wages, which also causes the shortage because nurses are being overworked with cost of living rising. Nurses play a significant role in caring for others are being paid the least with no benefits to support it. The great responsibility. Staffing was measured as the hospital's average patient to nurse ratio from the nurse survey data by dividing the average number of patients reported by nurses on their units on their last shift by the average number of nurses on the unit. Hospitals were categorized into 3 groups and had the highest quartile as hospitals having poor staffing, according to Aiken et al. However, there is a way to change these shortages by paying more money to nurses and offering better health benefits. The solution to this nursing shortage would be to have more accredited nursing schools, give more incentives to teachers wanting to be an educator in nursing, and nursing schools should be more hands-on training rather than the student learning things that are not necessary or pertain to nursing, making the program's length shorter. Imagine being a nurse and going home feeling great about the shift that you just completed. This being due to you being able to focus on your patient and not feeling like you have been rushed to take care of your patient, often neglecting some of their care. Also, employees would make you feel, if the employers would make you feel appreciated while you were there by making sure your patient ratio is not too heavy, this will make nurses want to work and not feel burnout. Evidence shows that there is a growing issue with nursing shortage, which directly affects the patient that needs care. Nursing is a rewarding career in feeling that you have saved someone's life or helped identify or correct a diagnosis. This is a call to action. We must act now to increasing the nursing workforce through education retention and policy changes. We need to go to the American Nursing Association in your state, make them accountable by making them go to legislators and fighting for changes now.